Let's talk about vitamin B1, also known as thiamine, is essential for the body's growth, development, and cellular functions. It plays a crucial role in converting food into energy. A deficiency in vitamin B1 can lead to a condition known as beriberi, which can be serious if it becomes severe and chronic. People at risk include excessive alcohol intake, diuretic use like furosemide, and people on dialysis and pregnant women not taking prenatal vitamins. This is due to low dietary intake or due to poor absorption in your gut. There are two types of beriberi. If you experience difficulty walking, numbness of limbs, nausea, confusion, it is called dry beriberi. People with wet beriberi have tachycardia, rapid heartbeat, edema of extremities, swelling of hands and legs, and abdomen, dyspnea, shortness of breath, and fatigue. Complications. If left untreated, thiamine deficiency can be very severe and lead to psychosis, paralysis, difficulty walking due to muscle atrophy, and even heart failure. You can prevent thiamine deficiency, balanced nutrition and dietary supplementation for those with low vitamin B1 intake and avoiding alcohol, which impairs its absorption from the gut. Treatment includes B1 prescriptions, either orally or parenterally, depending on the severity. Daily dosage varies depending on age and sex, but in general it is about 1 mg per day and slightly higher in pregnant women, around 1.4 mg per day. Natural sources of vitamin B1 include whole grains, legumes, milk, eggs and meat. Some foods like shrimp and milled grains like rice contain an enzyme called thiaminases, which can also lead to deficiency. It's important to consult with a healthcare provider for a proper diagnosis and treatment plan if you suspect a B1 deficiency. They may conduct physical examinations, blood tests, dietary history reviews, and urine tests to determine thiamine levels.